Right now, somewhere in America, a family is sitting in a doctor's office. They went in thinking it was just stress, maybe age, maybe poor sleep. They came out with a word that changed everything: dementia. And here's the part that keeps me up at night. For millions of those families, it was not inevitable. It was not written in their genes. It was not the unstoppable march of time doing what time does. It was a pill their doctor prescribed, a pill their pharmacy filled, a pill sitting quietly on a bathroom shelf right now, looking completely harmless, doing anything but. I am Dr. Willie. I have spent 15 years watching intelligent, sharp, vibrant people slowly lose themselves and watching their families blame age for something a medication was doing all along. Today I am going to show you 9 specific drugs that research has directly tied to rapid, measurable memory loss. We are counting down from number 9 to number 1. And number 1 is not what you expect. It is not a single pill at all. It may be the most dangerous hidden pattern in modern medicine, and almost nobody is talking about it. Stay with me through this entire video, because if you or someone you love takes any daily medication, prescription or over-the-counter, what you hear in the next 20 minutes could change the rest of your life. Let us begin. Number 9 is already inside most homes in America right now. It sits on an open shelf at every drugstore. No prescription needed. Costs a few dollars. Millions of people, especially older adults, take it every single night without a second thought. It is diphenhydramine. You know it as Benadryl. People reach for it to fall asleep, to quiet allergies, to take the edge off a cold. And because it requires no prescription, most people assume it must be gentle, harmless, safe. Inside your brain, it tells a very different story. Benadryl belongs to a class of drugs called anticholinergic. That word is going to come up repeatedly in this video, so understand what it means. Anticholinergic drugs block a chemical messenger in the brain called acetylcholine. And acetylcholine is not just any chemical. It is a primary signal your brain uses to form new memories and stay mentally alert. Here's the critical detail. As we age, our brains naturally produce less acetylcholine. We are already running low. So a drug that blocks what little we have left hits an older brain with far more force than a younger one. The structure that suffers most is the hippocampus, the seahorse-shaped region deep in the brain where every new memory is first recorded before it gets stored permanently. When acetylcholine is blocked here, new memories cannot form cleanly. They slip, they blur, they disappear. In my own practice, I have watched patients take a nightly antihistamine for years, and slowly lose their sharpness, their recall, their clarity, and never once connect the fog to the small pink pill sitting beside their bed. The research is not vague about this. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared to those who avoided them. 54%. From a pill most people treat like candy. What to do? Read the label on anything marketed for sleep, or anything labeled PM, nighttime, or allergy relief. These products are very often simply Benadryl in a different package. If you use it for allergies, newer antihistamines like loratadine, sold as Claritin, work without crossing into the brain the way Benadryl does, and are far safer for long-term use. Never stop a medication abruptly without speaking to your doctor first. But stop assuming that over-the-counter means safe for your memory. It does not. Number 8 is the one your stomach loves, and your brain quietly pays for. Omeprazole, esomeprazole, sold as Prilosec and Nexium. These drugs shut down acid production in the stomach and are prescribed for heartburn, acid reflux, and that burning pain after meals. They work well. They provide real relief. And so people stay on them, sometimes for years, sometimes for decades, because the moment they stop, the symptoms return. What almost nobody hears at the pharmacy counter is this: your stomach needs acid to extract certain critical nutrients from the food you eat. Chief among them is vitamin B12, which protects the insulation around your nerve fibers and plays a direct role in brain function. When you suppress acid long enough, B12 levels drop quietly and steadily. Magnesium and calcium drop with them. 2 minerals your brain cells depend on to fire and communicate clearly. Starve your neurons of those nutrients long enough, and you get misfires, confusion, memory lapses that look clinically identical to early Alzheimer's disease, when the real cause is a nutritional deficiency your medication has been creating for years. Beyond nutrients, PPIs have also been shown to raise levels of amyloid beta, the sticky protein found in abnormal amounts in the brains of Alzheimer's patients. A large 2016 study in JAMA Neurology examined more than 73,000 adults aged 75 and older. Regular PPI users had a 44% higher risk of dementia than non-users. What to do? If you take a PPI every single day without periodic reassessment, that conversation needs to happen with your doctor soon. Many people can step down to a gentler class called H2 blockers, famotidine, sold as Pepcid, which carry far less cognitive risk. Deglycerinated licorice, a natural compound, can also soothe the stomach lining without touching the brain at all. The goal is the lowest dose of the shortest time, not a pill taken forever out of habit. Number 7 is prescribed for a problem most people would rather not discuss in public: oxybutynin, sold as ditropan. It is given to older adults dealing with sudden, urgent bladder control problems, the kind that can quietly reshape an entire day, limiting where you go, what you do, and how freely you live. The relief it provides is real. The embarrassment it spares people is real. But here is what most patients are never told. Oxybutynin works by blocking acetylcholine, the exact same memory chemical that Benadryl disrupts. And unlike some drugs that are filtered out before reaching the brain, oxybutynin crosses into brain tissue very easily and settles directly in the regions where memories are made. Taken month after month, year after year, this drug does quiet, cumulative damage to cognition. In 2019, the British Medical Journal published a landmark study of adults over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher than those who did not, nearly 1 in 2. And here is what troubles me most about this one. Almost none of them were warned. They were told medication would help their bladder. Nobody told them it might be slowly dimming their mind at the same time. The fog gets blamed on age. Patients describe forgetting appointments, losing keys repeatedly, losing the thread of a simple conversation. Everyone around them nods and says, "Well, you are getting older." It is rarely traced back to prescription until real and irreversible ground has been lost. There is good news. You do not have to choose between your bladder and your brain. A newer class of medication, mirabegron, sold as Myrbetriq, works through an entirely different biological pathway and does not block acetylcholine at all. For most older adults, it provides equivalent control with dramatically less risk to cognitive function. Bring this up at your next appointment. Ask by name. Number 6 is one of the most prescribed drugs on the planet, and what follows is not an argument against it. It is the half of the story most patients are never given. Simvastatin, atorvastatin, sold as Zocor and Lipitor. These are cornerstone medication for lowering cholesterol and reducing the risk of heart attack and stroke. They belong in many people's lives, and for good reason. But here is what most doctors do not explain when they write the prescription. Cholesterol is not just a cardiovascular risk factor. Your brain is nearly 60% fat. It uses cholesterol to build and maintain the myelin sheath, the protective insulation that wraps around every nerve fiber so that electrical signals travel quickly and accurately. Lower cholesterol aggressively enough, and the brain can be left short of a raw material it genuinely needs to function. The statins that cause the most concern are the ones that cross most easily into brain tissue, simvastatin being the primary example. A 2023 study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment. The higher the dose, the steeper the decline. Some patients describe frightening episodes. A familiar name simply gone, a conversation from minutes ago completely erased, a route they have driven for decades suddenly unfamiliar. And because the heart benefits of statins are real and significant, these cognitive changes often go unreported because people fear the alternative. Not all statins behave the same way. Pravastatin and rosuvastatin do not penetrate brain tissue as readily and are generally considered cognitively safer alternatives when protection against heart disease is genuinely needed. If you've been on a statin for years and have noticed increasing fog or forgetfulness, this is a real, legitimate conversation to have with your doctor about dose, about alternative medications, about what trade-off you're actually making. Never stop a statin on your own, but do not stay silent either. Bring this up at your next appointment. Ask by name. Number 5 may be the most quietly addictive class of medication on this list, and for many people, it arrived as a rescue. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. They're prescribed for anxiety and insomnia, two conditions that are extremely common in older adults and that genuinely cause suffering. These drugs calm an overactive nervous system quickly and reliably. At first, they feel like relief. The panic subsides. The racing thoughts slow down. Sleep finally comes. But over time, the picture darkens considerably. A 2022 study in the British Medical Journal followed more than 8,000 seniors across 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. What these medications do, gradually and persistently, is create a chemical sedation of the entire brain. Learning slows. Mental flexibility decreases. Many people describe a sensation of emotional flatness, moving to the world behind glass, no longer feeling fully like themselves, while everyone around them assumes it is just aging. The cruelest feature of benzodiazepines is the exit. Stop them abruptly and anxiety and insomnia return with far greater intensity than before. Agitation can become severe and physically dangerous. This makes the medication feel essential at precisely the moment it may be causing the greatest harm. This is critical. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly. Stopping abruptly can be life-threatening. A gradual medical taper, done slowly over weeks or months under your doctor's direct supervision, is the only safe path. Alternatives exist. Buspirone can reduce anxiety without sedation. Specific forms of cognitive therapy designed for insomnia and anxiety have shown strong results without any chemical cost to the brain. Number 4 carries one of the heaviest hidden burdens on this entire list, and it wears 3 different disguises. Amitriptyline, sold as Elavil, is an older antidepressant that is still widely prescribed today, not just for depression, but for nerve pain, sleep difficulties, and migraine prevention. That versatility made it enormously popular. A single medication for 3 different problems sounds efficient. What it also is, beneath the surface, is one of the most powerful anticholinergic drugs still in common use. It blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and begin resembling an expected outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest long-term exposure to anticholinergic drugs, with amitriptyline among the leading contributors, had a 54% greater risk of developing dementia over a 10-year period. And almost none of them were warned. They were given it for pain or for sleep. They gradually noticed words disappearing, memory becoming thinner, concentration weakening, and they assumed, as everyone around them assumed, that it was simply age taking its course. It does not even require a large dose. A small nightly amount, taken consistently for years, can quietly erode cognitive function without a single dramatic warning sign until the loss becomes significant. If you or someone you love takes amitriptyline, that conversation belongs at the next doctor's appointment. For nerve pain, duloxetine or gabapentin may offer comparable relief without the same anticholinergic burden. For sleep, melatonin or very low-dose doxepin are gentler options. For mood, newer antidepressants like sertraline and escitalopram are generally considered much safer for the aging brain. I told you to watch for number 3. Here it is, paroxetine, sold as Paxil. It belongs to a family of antidepressants called SSRIs, a class that, on the surface, is considered modern, well-tolerated, and far gentler than older psychiatric medications. And most SSRIs are, in fact, reasonably safe for the aging brain. Paroxetine is the exception hiding inside the group. It is the one SSRI with significant anticholinergic activity. That single characteristic, not shared by sertraline, not shared by escitalopram, means it disrupts the same acetylcholine system that every other drug on this list has been attacking. It simply does it while wearing the identity of a gentle, modern antidepressant. A 2021 review in Frontiers in Psychiatry found that older adults taking paroxetine showed measurable declines in short-term memory, word recall, and attention within the first 12 months of use. Paroxetine users were 30% more likely to show early signs of cognitive impairment than seniors taking other antidepressants. The painful irony is sharp. This medication is prescribed to stabilize and support the mind. Over time, it may erode the very clarity it was meant to protect. The American Geriatric Society recognized this risk formally and placed paroxetine on the Beers criteria, a catalog of medications considered potentially inappropriate for adults over 65. It is on that list specifically because of cognitive risk. If you take paroxetine, speak with your doctor about switching to a safer alternative. Sertraline or escitalopram are the most commonly recommended option. The switch can often be done gradually and smoothly, and the cognitive benefit may become noticeable within months. Number 2 concerns me deeply. And the reason it concerns me is not just what these medications do. It is how often patients never knew they were taking them in the first place. Quetiapine, sold as Seroquel. Risperidone, sold as Risperdal. Olanzapine, sold as Zyprexa. These were developed for serious psychiatric conditions, schizophrenia, severe bipolar disorder, powerful medications for serious illness. Today they are prescribed, often casually and off-label, to older adults for sleep problems, mild restlessness, or agitation and dementia, sometimes primarily because an overwhelmed caregiver or a busy nursing facility needs a patient to be quieter and easier to manage. Medications designed for severe psychiatric illness are being used on seniors who are simply confused or restless or frightened. The cost is staggering. A 2022 study in Lancet Healthy Longevity tracked more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a single year, even when they had no prior history of dementia. These medications also increase the risk of stroke, sudden cardiac death, and falls from profound sedation. They work by suppressing dopamine, a chemical involved not only in mood, but in focus, planning, motivation, and memory. Reduce dopamine enough and the brain becomes slower, less responsive, less present. Families describe watching someone they love fade while that person is still sitting in the same room, physically there but increasingly absent. If a family member is taking one of these medications, ask the prescribing physician directly, why was this started? Is it truly necessary, or is it being used primarily for convenience? Many behavioral symptoms in older adults respond well to consistent routines, reduce environmental overstimulation, proper treatment of hidden pain, and careful management of sleep. When medication is genuinely required, the lowest effective dose for the shortest possible time dramatically reduces the risk. And now we reach number 1. You were expecting a single worse pill, a final villain with a name. The reality is more dangerous than that. Number 1 is anticholinergic polypharmacy, the silent, invisible, almost never discussed accumulation of multiple medications all blocking the same brain chemical simultaneously, while nobody adds up the total damage being done. Picture a very common scenario. A senior takes Benadryl every night for sleep, oxybutynin every morning for bladder control, amitriptyline each evening for nerve pain. Each prescription was written by a doctor. Each seems reasonable in isolation. Together, they are dismantling the same neurological system from 3 different directions at once. A 2022 study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest combined anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double the risk. And the overwhelming majority had absolutely no idea they were accumulating that burden. No one had explained it to them. No one had added it up. When acetylcholine is suppressed from multiple sources simultaneously, the brain does not simply slow down. Neurons begin to weaken from chronic underuse. Connections thin and contract. The brain settles into a quiet, underpowered state that is clinically indistinguishable from early Alzheimer's disease during cognitive testing. People lose years they did not have to lose. Here is the part one most need you to hear. Medication-induced cognitive decline is often reversible when it is caught early. Reduce the anticholinergic burden under medical supervision, and many people begin regaining clarity, energy, and memory within weeks or months. The brain is far more resilient than most people realize, but only if the source of the harm is identified and removed. The solution is not complicated. It is a medication review, a deliberate, comprehensive conversation with your doctor or pharmacist in which every prescription drug, every over-the-counter product, and every supplement is laid out and examined together. Simple anticholinergic burden scoring tools exist and are widely available. They can identify risk quickly. Once the problematic medications are identified, unnecessary ones can be reduced or discontinued safely. Safer alternatives can be introduced, and the brain can be given the opportunity it deserves to recover. This may be the most preventable driver of cognitive decline in the aging population today. That is why it is number 1. So here is where I want to leave you. Of the 9 medications we covered today, How many are currently in your home? How many do you take every single day without ever questioning them? You do not have to accept cognitive decline as inevitable. You do not have to assume that the fog you feel, or the fog someone you love is living in, is simply aging doing what aging does. Sometimes, more often than medicine acknowledges, it is a pill that can be changed, reduced, or replaced. Ask for a medication review this week. Say those words specifically to your doctor or your pharmacist. I would like a review of my medications for anticholinergic burden. That one conversation could change everything. Tell me in the comments, which of these medications surprise you most? And are you going to ask for a review? I read every comment. And your answer might be the one that helps the next person who reads it. Before you go, the warning signs do not stop at your medicine cabinet. Your body is sending you signals right now that most people never learn to read. Your fingernails, something you look at every single day, can reveal early warnings about your kidneys, your blood supply, and your nervous system, sometimes years before any other symptoms appear. That is the topic of the next video. I will show you the 4 nail signs worth checking tonight.